Hi everyone, I'm Vivian P, and I just graduated Sonoran Science Academy. I will be attending the University of Arizona in the fall.
And I'm Ollie Mode. I graduated from Flowing Wells High School and I'll be at Stanford in the fall.
Our lab is off campus. We work with Dr. Schneider at his private clinic, Tucson Eye Care, at 4711 East Camp Lowell Drive. Dr. Schneider is a practicing ophthalmologist and he also does research. He was the former head of the Department of Ophthalmology at the University of Arizona.
And we're in Schneider's office.
So the disease we're focusing on in this lab is age-related macular degeneration. It's basically a disease where your macula, which is the focal point of your retina in the back of your eye, gets damaged, which causes vision loss. And there are two main types of age-related macular degeneration, or AMD for short, and both are precursed by things called drusen. And they're buildups in your retina, but we don't actually know what they are yet. They could be extra protein, they could be fat, they could be cellular waste, but we don't know what they are. But we know that when they build up and grow, which will happen to most people, they can cause more problems and eventually lead to late-stage AMD. So there are two main types of late-stage AMD. There's dry AMD and wet AMD. And in wet AMD, fluid builds up in and under the retina, which causes vision loss. And unfortunately, there is no cure for that right now, but anti-VEGF treatments are used to reduce some of that liquid in the eye. But there is a problem with these anti-VEGF injections. They're uncomfortable. You're literally taking a needle and injecting it into your eye. So other treatments are being sought after. And Dr. Schneider, our mentor, he's been trying to develop a drug that can either supplement or maybe even replace these injections to help out with wet AMD. And he was actually able to prove that levodopa taken orally is able to reduce the retinal fluid in patients with wet AMD. So that project extends into our project, which is basically we are seeing if levodopa taken orally in those same patients is able to reduce the volume of drusen before those patients' eye develop wet AMD.
Just as Ali said, we're doing follow-ups of the clinical trial to look at the eye with dry AMD after treatment. To do so, we look at OCT scans, and these are scans of the retina. And through it, we can scroll through and we can look for tears, drusens, and fluid. So we go through and we find big enough drusens that looks like they could cause problems in the future and quantify them. We use tools that the program gives us to measure these drusens, and we take these measurements from when the patient began treatment, the 6-month mark, and the 1-year mark, and we put all of that in a spreadsheet. So most of our data shows that there were minimal drusen growth and even some reduction in drusen volume. However, there isn't, we can't say that they have much statistical significance as we don't have a baseline. Overall, there isn't enough literature on average drusen growth, and there isn't a standardized way of measuring drusen volume, which is why we have no baseline.
Okay, my final questions are how big of a role does melanin play in the body, and if the circadian rhythm actually plays a role in macular degeneration?
Then my final questions are, what other physiological pathways involve L-DOPA, and what role does melatonin play in developing AMD?